In this lesson, we are going to discuss the endocrine system. At the end of this video lesson, you should be able to explain the functions of the hormones of the endocrine system, explain the effects of some hormonal hyposecretion and hypersecretion, and lastly, identify the relationships of some hormones with each other. The endocrine system is one of the body's two major regulatory systems, the other being the nervous system. In general, the nervous system coordinates rapid, precise responses and is especially important in mediating the body's interactions with the external environment. The endocrine system, by contrast, primarily controls activities that require duration rather than speed. It regulates, coordinates, and integrates cellular and organ function at a distance. Endocrinology is the study of the homeostatic chemical adjustments and other activities that hormones accomplish. Even though the endocrine glands for the most part are not connected anatomically, they constitute a system in a functional sense. They all accomplish their functions by secreting hormones into the blood, and many functional interactions take place among the various endocrine glands. Even though the blood distributes hormones throughout the body, only specific target cells can respond to each hormone because only the target cells have receptors for binding with a particular hormone. Endocrine disorders most commonly result from abnormal plasma concentrations of a hormone caused by inappropriate rates of secretion, that is, too little hormone secreted or hyposecretion, or too much hormone secreted or hypersecretion. We are going to discuss the different hormones of the endocrine system by discussing each gland. The first is the pituitary gland. The pituitary gland is a small endocrine gland located in the bone cavity at the base of the brain, just below the hypothalamus. The pituitary is connected to the hypothalamus by a thin connecting stalk. If you point one finger between your eyes and another finger toward one of your ears, the imaginary point where these lines would intersect is about where your pituitary is located. The pituitary has two anatomically and functionally distinct lobes: the posterior pituitary or the back lobe and the anterior pituitary or the front lobe. We're going to discuss first the posterior pituitary. The posterior pituitary does not actually produce any hormones. It simply stores and, on appropriate stimulation, releases into the blood two small peptide hormones. The first one is vasopressin or antidiuretic hormone or ADH. It enhances retention of water by the kidney nephrons during urine formation, which is an antidiuretic effect. Under normal conditions, vasopressin is the primary endocrine factor that regulates urinary water loss and overall water balance. The second is oxytocin. Oxytocin stimulates contraction of the uterine smooth muscle to help expel the infant during childbirth. Appropriately, oxytocin secretion is increased by reflexes that originate within the birth canal during childbirth. Oxytocin also promotes ejection of the milk from the mammary glands of the breast during breastfeeding. Oxytocin secretion is increased by reflexes that are triggered when the infant suckles the breast. In addition to these two major physiologic effects, oxytocin has recently been shown to influence a variety of behaviors, especially maternal behaviors. For example, this hormone fittingly facilitates bonding or attachment between a mother and her infant. Now, let us discuss the hormones of the anterior pituitary. Unlike the posterior pituitary, which does not necessarily release hormones, the anterior pituitary itself synthesizes the hormones it releases into the blood. 5 different cell populations within the anterior pituitary secrete 6 major peptide hormones. First, the thyrotropes secrete a thyroid-stimulating hormone, or TSH or thyrotropin, which stimulates secretion of thyroid hormones T3 and T4 and growth of the thyroid gland. Corticotropes produce and release adrenocorticotrophic hormone or ACTH, the hormone that stimulates cortisol secretion by the adrenal cortex and promotes growth of the adrenal cortex. The type of anterior pituitary cells known as somatotropes secrete growth hormone or GH or somatotropin, the primary hormone responsible for regulating overall body growth. GH also exerts important metabolic actions. By means of IGF-1, It indirectly stimulates protein anabolism and growth of bones and soft tissues. Direct metabolic effects include fat mobilization and glucose conservation. Hyposecretion of growth hormone in the child is one cause of dwarfism. The predominant feature is short stature caused by retarded skeletal growth. Less obvious characteristics include poorly developed muscles due to reduced muscle protein synthesis and excess subcutaneous fat or less fat mobilization. Hypersecretion of the growth hormone is most often caused by a tumor of the growth hormone-producing cells of the anterior pituitary. The symptoms depend on the age of the individual when the abnormal secretion begins. If overproduction of GH begins in childhood before the epiphyseal plates close, the principal manifestation is a rapid growth in height without a distortion of body proportions. Appropriately, this condition is known as gigantism. If not treated by removal of the tumor or by drugs that block the effect of GH, the person may reach a height of 8 feet or more. All the soft tissues grow correspondingly so that the body is still well proportioned. If GH hypersecretion occurs after adolescence when the epiphyseal plates have already closed, further growth in height is prevented. Under the influence of excess GH, however, the bones become thicker and the soft tissues, especially connective tissue and skin, proliferate. This disproportionate growth pattern produces a disfiguring condition known as acromegaly. Acro means extremity, megaly means large. Bone thickening is most obvious in the extremities and face. A marked coarsening of the features to an almost ape-like appearance gradually develops as the jaws and cheekbones become more prominent because of the thickening of the facial bones and the skin. The hands and the feet enlarge, and the fingers and toes become greatly thickened. Peripheral nerve disorders often occur as nerves are entrapped by overgrown connective tissue or bone. Follicle-stimulating hormone or FSH helps regulate gametes. In females, it stimulates growth and development of ovarian follicles within which the ova or eggs develop. It also promotes secretion of the hormone estrogen by the ovaries. In males, FSH is required for sperm production in the seminiferous tubules of the testes. Luteinizing hormone or LH helps control sex hormone secretion in both sexes, among other important actions in females. In females, LH is responsible for ovulation and luteinization, that is, the formation of a hormone-secreting corpus luteum in the ovary following ovulation. LH also regulates ovarian secretion of the female sex hormones, estrogen and progesterone. Lastly, lactotropes secrete prolactin or PRL, which enhances breast development and milk production, that is, lactation in females. Its function in males is uncertain, although evidence indicates that it may induce the production of testicular LH receptors. Furthermore, recent studies suggest that prolactin may enhance the immune system and support the development of new blood vessels at the tissue level in both sexes, both actions totally unrelated to its known roles in reproductive physiology. Now, let us discuss the hypothalamus. The hypothalamus, known as the master gland, secretes different hypothalamic hypophysiotrophic hormones that either stimulates or inhibits the secretion of each anterior pituitary hormone. Hypophysis means pituitary, tropic means nourishing. In each case, the primary action of the hormone is apparent from its name. Let us first discuss the releasing hormones of the hypothalamus. The thyroid-stimulating hormone or TSH is stimulated with the thyrotropin-releasing hormone or TRH. The adrenocorticotrophic hormone or ACTH is stimulated by the corticotropin-releasing hormone or CRH. Growth hormone or GH is stimulated by the growth hormone-releasing hormone or GHRH. The luteinizing hormone and the follicle-stimulating hormone are both stimulated by the gonadotropin-releasing hormone or GnRH. And lastly, prolactin or PRL is stimulated by the prolactin-releasing hormone or PRH. Now, let us discuss the inhibiting hormones of the hypothalamus. Growth hormone is inhibited by the growth hormone-inhibiting hormone or GHIH. And PRL or prolactin is inhibited by the prolactin-inhibiting hormone or PIH. Now, let us discuss the hormones of the pineal gland. The pineal gland is a tiny pinecone-shaped structure located in the center of the brain. Melatonin is a hormone derived from the amino acid tryptophan. Do not confuse melatonin with the skin-darkening pigment melanin. Melatonin helps keep the body's circadian rhythms in times with the light-dark cycle. On its own, this biological clock generally cycles a bit slower than the 24-hour environmental cycle. If the master clock were not continually adjusted to keep pace with the world outside, the body's circadian rhythms would become progressively out of sync with the cycles of light or periods of activity and dark or periods of rest. The effect of not maintaining the internal clock's relevance to the environment is well known by people who experience jet lag when their inherent rhythm is out of step with external cues. Now let's discuss the thyroid gland. The thyroid gland consists of two lobes of endocrine tissue joined in the middle by a narrow portion of the gland, the isthmus, giving it a bow-type shape. The gland is even located in the appropriate place for a bow tie, lying over the trachea just below the larynx. The secretory cells of the thyroid gland produce two iodine-containing hormones derived from the amino acid tyrosine, tetraiodothyronine or T4 or thyroxine, and triiodothyronine or T3. The prefixes tetra and tri and the subscripts 4 and 3 denote the number of iodine atoms incorporated into each of these hormones. These two hormones, collectively referred to as the thyroid hormone, are important regulators of overall basal metabolic rate. The basic ingredients for thyroid hormone synthesis are tyrosine and iodine, both of which must be taken up from the blood by the follicular cells. Tyrosine, an amino acid, is synthesized in sufficient amounts by the body, so it is not essential to the diet. The thyroid hormone does not have any discrete target organs. It affects virtually every tissue in the body. It increases the body's overall basal metabolic rate or BMR or idling speed. It is the most important regulator of the body's rate of oxygen consumption and energy expenditure under resting conditions. Closely related to thyroid hormone's overall metabolic effect is its calorigenic or heat-producing effect. Increased metabolic activity results in increased heat production. As discussed earlier, the thyroid-stimulating hormone or TSH from the anterior pituitary is the most important physiologic regulator of the thyroid hormone secretion. Hypothyroidism can result from primary failure of the thyroid gland itself, secondary to a deficiency of TRH, TSH, or both, or from an inadequate dietary supply of iodine. The symptoms of hypothyroidism are largely caused by a reduction in overall metabolic activity. If a person has hypothyroidism from birth, a condition known as cretinism develops. Because adequate levels of thyroid hormones are essential for normal growth and the central nervous system development, cretinism is characterized by dwarfism and mental retardation as well as other general symptoms of thyroid deficiency. Now, let's discuss thyroid hormone hypersecretion. The most common cause of hyperthyroidism is Graves' disease. This is an autoimmune disease in which the body erroneously produces thyroid-stimulating immunoglobulin, which is an antibody whose target is the TSH receptors on the thyroid cells. Symptoms include excessive perspiration and poor tolerance of heat, and the body weight typically falls because the body is burning fuel at an abnormally rapid rate. Another hormone of the thyroid gland is calcitonin. Interspersed in the interstitial spaces between the previously discussed thyroid secretory cells is another secretory cell type which secretes the peptide hormone calcitonin. Calcitonin plays a role in calcium metabolism and is not related in any way to the two other major thyroid hormones. Calcitonin lowers plasma calcium concentration but is not important in the normal control of calcium metabolism. Calcitonin works in two ways. On a short-term basis, calcitonin decreases calcium movement from the bone fluid into the plasma. On a long-term basis, calcitonin decreases bone reabsorption. This means that an increase in plasma calcium stimulates calcitonin secretion, and a fall in plasma calcium inhibits calcitonin secretion. Calcitonin may play a role in protecting skeletal integrity when there is a large calcium demand, such as during pregnancy or breastfeeding. Furthermore, Some experts speculate that calcitonin may hasten the storage of newly absorbed calcium following a meal. Now, let us discuss the parathyroid gland. The parathyroid is a 4 rice grain-sized glands located on the back surface of the thyroid gland, one in each corner. Parathyroid hormone or PTH is a peptide hormone secreted by the parathyroid glands. PTH is essential for life. The overall effect of PTH is to increase the calcium concentration of plasma, thereby preventing hypocalcemia. By its action on bone, kidneys, and intestine, PTH raises plasma calcium level when it starts to fall so that hypocalcemia and its effect are normally avoided. PTH uses bone as a bank from which it withdraws calcium as needed to maintain plasma calcium level. Under the influence of PTH, the kidneys can reabsorb more of the filtered calcium, so less calcium escapes into urine. This effect increases the plasma calcium level and decreases urinary calcium losses. This hormone also acts to lower plasma phosphate concentration. This PTH-induced removal of extra phosphate from the body fluids is essential for preventing reprecipitation of the calcium freed from the bone. PTH also stimulates vitamin D activation. Vitamin D is actually a hormone that increases calcium absorption in the intestine. Osteoporosis is a decrease in bone density resulting from reduced deposition of the bone's organic matrix. It is responsible for the greater incidence of bone fractures among women over the age of 50 than among the population at large. Because bone mass is reduced, the bones are more brittle and more susceptible to fracture in response to a fall, blow, or lifting action that normally would not strain stronger bones. For every 10% loss of bone mass, the risk of fracture doubles. Now, let's discuss the adrenal gland. There are 2 adrenal glands, one embedded above each kidney in a capsule of fat. Ad means next to. Renal means kidney. Each adrenal is composed of 2 endocrine organs, one surrounding the other. The outer layer is the adrenal cortex. The inner portion is the adrenal medulla. The adrenal cortex and medulla secrete hormones belonging to different chemical categories whose functions, mechanisms of action, and regulation are entirely different. Let's first discuss the hormones of the adrenal cortex. Mineralocorticoids, mainly aldosterone, influence mineral or electrolyte balance, specifically sodium ion and potassium ion balance. The principal site of aldosterone action is on the distal and collecting tubules of the kidney, where it promotes sodium retention and enhances potassium elimination during the formation of urine. The promotion of sodium retention by aldosterone secondarily induces osmotic retention of water, expanding the extracellular fluid volume, which is important in the long-term regulation of blood pressure. Mineralocorticoids are essential for life. Without aldosterone, a person rapidly dies from circulatory shock because of the marked fall in plasma volume caused by excessive losses of water-holding sodium. Cortisol, the primary glucocorticoid, plays an important role in carbohydrate, protein, and fat metabolism, executes significant permissive actions for other hormonal activities, and helps people resist stress. The overall effect of cortisol's metabolic actions is to increase the concentration of blood glucose at the expense of protein and fat stores. It stimulates hepatic gluconeogenesis, the conversion of non-carbohydrate sources, namely amino acids, into carbohydrate within the liver. Between meals or during periods of fasting, when no new nutrients are being absorbed into the blood for use and storage, the glycogen or stored glucose in the liver tends to become depleted as it is broken down to release glucose into the blood. Gluconeogenesis is an important factor in replenishing hepatic glycogen stores and thus in maintaining normal blood glucose levels between meals. Cortisol also plays a key role in adaptation to stress. Stress of any kind is one of the major stimuli for increased cortisol secretion. For example, a human wounded or faced with a life-threatening situation must forego eating. A cortisol-induced shift away from protein and fat stores in favor of expanded carbohydrate stores and increased availability of blood glucose would help protect the brain from malnutrition during the imposed fasting period. Excessive cortisol secretion, or Cushing syndrome, can be caused by overstimulation of the adrenal cortex by excessive amounts of corticotrophin-releasing hormone and/or ACTH. Adrenal tumors that uncontrollably secrete cortisol independent of ACTH, or ACTH-secreting tumors located in places other than the pituitary, most commonly in the lung. Its common symptom is abnormal fat distributions due to the deposited extra glucose. The adrenal cortex also produces sex hormones that are identical or similar to those produced by the gonads, testes in males and ovaries in females. The most abundant and physiologically important of the adrenocortical sex hormones is a weak androgen or male sex hormone. Accordingly, males have a dominance of circulating androgens, whereas in females, estrogens predominate. However, no hormones are unique to either males or females except those from the placenta during pregnancy, because the adrenal cortex in both sexes produces small amounts of the sex hormone of the opposite sex. The adrenal androgen is overpowered by testicular testosterone in males, but is of physiologic significance in females who otherwise have very little androgens. This adrenal androgen governs androgen-dependent processes in the female, such as growth of pubic and armpit hair, enhancement of the pubertal growth spurt, and development and maintenance of the female sex drive. Let's now discuss the hormones of the adrenal medulla. Like sympathetic fibers, the adrenal medulla releases norepinephrine, but its most abundant secretory output is a similar chemical messenger known as epinephrine. Epinephrine and norepinephrine are the same, except that the epinephrine also has a methyl group. Together with the sympathetic nervous system, the adrenal medulla releases epinephrine or adrenaline to mobilize the body's resources to support peak physical exertion in emergency or stressful situations. The sympathetic and epinephrine actions constitute a fight-or-flight response that prepares the person to combat an enemy or flee from danger. Together, these effects raise arterial blood pressure, thus ensuring an appropriate driving pressure to force blood to the organs most vital for meeting the emergency. Now, let's discuss the hormones of the pancreas. The pancreas is an organ composed of both exocrine and endocrine tissues. The exocrine portion secretes a watery, alkaline solution and digestive enzymes through the pancreatic duct into the digestive tract lumen. Scattered throughout the pancreas between the exocrine cells are about 1 million clusters or islands of endocrine cells known as the islets of Langerhans. The alpha cells of the pancreas secrete glucagon. The overall effects of glucagon on carbohydrate metabolism result in an increase in hepatic glucose production and release, and thus an increase in blood glucose levels. Glucagon exerts its hyperglycemic effects by decreasing glycogen synthesis, promoting glycogenolysis, and stimulating gluconeogenesis. Glucagon also enhances hepatic ketone production or ketogenesis by promoting the conversion of fatty acids to ketone bodies. Thus, the blood levels of fatty acids and ketones increase under glucagon's influence. Glucagon also promotes protein catabolism in the liver, but it does not have any significant effect on blood amino acid levels because it does not affect muscle protein, the major protein stored in the body. The beta cells of the pancreas secrete insulin. Insulin has important effects on carbohydrate, fat, and protein metabolism. It lowers the blood levels of glucose, fatty acids, and amino acids, and promotes their storage. As these nutrient molecules enter the blood during the absorptive stage, insulin promotes their cellular uptake and conversion into glycogen, triglycerides, and protein respectively. Insulin synthesizes glycogen both in the skeletal muscles and liver from glucose molecules, a process known as glycogenesis. With this, insulin inhibits glycogenolysis, the breakdown of glycogen into glucose. Diabetes mellitus is by far the most common of all endocrine disorders. The acute symptoms of diabetes mellitus are attributable to inadequate insulin action. Because insulin is the only hormone capable of lowering blood glucose levels, one of the most prominent features of diabetes mellitus is elevated blood glucose levels or hyperglycemia. Type 1 diabetes occurs when there is insulin hyposecretion. Type 2 diabetes occurs when there is reduced sensitivity of insulin. Now, let us discuss the thymus. The thymus is a lymphoid tissue located midline within the chest cavity, above the heart in the space between the lungs. The thymus produces thymosin, a hormone important in maintaining the T-cell lineage. Thymosin enhances proliferation of new T-cells within the peripheral lymphoid tissues and augments the immune capabilities of existing T-cells. T lymphocytes or T-cells directly destroy virus-invaded cells and mutant cells by releasing chemicals that punch lethal holes in the victim cells. This is called cell-mediated immunity. Secretion of thymosin decreases after about 30 to 40 years of age. This decline has been suggested as a contributing factor in aging. The primary reproductive organs, or gonads, consist of a pair of testes in the male and a pair of ovaries in the female. The gonads produce testosterone in males and estrogen and progesterone in females. Testosterone is a steroid hormone derived from a cholesterol precursor molecule. Once produced, some of the testosterone is secreted into the blood, where it is transported, primarily bound to plasma proteins, to its target site of action. A substantial portion of the newly synthesized testosterone goes into the lumen of the seminiferous tubules, where it plays an important role in sperm production. Also, all male secondary sexual characteristics depend on testosterone for their development and maintenance. Estradiol is the primary estrogen produced during a female's reproductive years. It promotes follicular development, governs development of secondary sexual characteristics, and stimulates uterine and breast growth. Progesterone primarily maintains the lining of the uterus for a possible pregnancy. Other functions of progesterone include the promotion of fat use for energy, regulation of blood sugar levels, and normalizing blood clotting. It has also been shown to have antidepressant functions. To conclude this lesson, let us review the following key points. Through its relatively slow-acting hormone messengers, the endocrine system generally regulates activities that require duration rather than speed. Glands located in the brain are part of the central endocrine system. This function in water balance, secretion of other hormones, metabolism, and circadian rhythm. The other glands are called peripheral glands. This function in the maintenance of the proper concentration of nutrients, stress response, and growing process and control. And lastly, hyposecretion happens when too little hormone is secreted. Hypersecretion happens when too much hormone is secreted. And that ends our discussion on the endocrine system.